today we're going to actually talk about the spectrum of heat illness. I have Dr. Chalam here with me and the patient's mom, who's agreed to help us with this video.
Mm-hmm.
So basically, I'm going to do a little bit kind of a description of actually what happened, and what I understand, and then you straighten me out. You correct me if I'm wrong on this. That he was out running. He's going to be a football player, and he's been running for the last 3 weeks. Is that right?
Maybe just 1 to 2 weeks. Yeah.
More like 2 weeks.
Yeah,
Okay.
Every other day.
Every other day.
Swimming.
Swimming.
He's a swimmer too.
Okay. And so he's trying to get in shape for football. And today he was doing a 3-mile run. And about what time was that?
Maybe 8:30 or 9.
Okay, so it's early in the morning. I mean, this is Mobile, Alabama,
Yeah.
and so it does get hot down here. But so at the end of his run, at the end of the 3 miles, he started to get a little bit wobbly, a little unsteady on his feet, and then you pulled him off to the side. What did you see? What was he doing?
Well, I noticed I was maybe like 50 yards back. So I saw him looking a little wobbly, so I was like, slow down, just walk, or slow down. But it's almost like he was sprinting. I think he just wanted to hurry up and
Do a sprint at the end, okay?
Yeah. So I got up to him, and he said, I'm not feeling good, I'm feeling dizzy. And he put his arm around me, and like I could tell at that point he was, definitely feeling a little lightheaded.
Right.
Didn't think too much about it. So we kept going, maybe 25, 30 more feet down, and so we found a shady spot. He saw it, I said, let's just sit down on the curb in the shade and cool off. I had him put his head between his knees, but it really just wasn't doing any good. And then he said, can I lay back? And he laid back, and from there it all just kind of went downhill as that.
Okay, he did not like collapse and roll.
No, there was
backwards.
no falling. There was no sudden
event
going down.
Okay.
It was more just kind of gradual, and when I naturally tried to cool him down, as you do when you think you're getting a little hot and tired, it just didn't work.
Okay.
And so I guess his body was still hot, even though we had stopped the motion, but it wasn't working.
Okay, so he laid back and then became unresponsive.
Yeah, almost kind of sleepy. I could tell he was breathing normally, or I could tell like he was okay, but it was like he was just very, very droggy.
Okay.
And I said, can sit back up, and I think I even pulled him up a couple times, and he was just sort of like hunched over, like it was, and then I started getting a little scared.
Was he acting confused?
At that point, he wasn't saying anything.
Okay.
Very, like he was just in a deep sleep almost, but he was still kind of sleep. He could hold himself up, and at that point, my neighbor, who is a doctor, pulled out of his driveway, and so I flagged him over, and then we began together, kind of as a team, trying to rouse him up. He brought out some ice, and we put a cold pack on his neck. He wouldn't open his eyes or talk to me, but I put a piece of ice in his mouth, and he would chew it.
Okay.
So that was kind of the only response I could get from him. But like I would put the ice there, he would chew it.
Yeah.
And I thought, well, that's good. At least he's getting the liquid and it's cold.
Yeah.
But we were still concerned that he wasn't talking back.
Okay.
And that went on for a few minutes.
And his eyes were closed the entire time during this?
Yeah, I think so.
So
maybe if pretty much.
When you tried to arouse him, would he open his eyes and look at you, or no?
Not really.
Okay.
No.
So what made you call 911?
Because I felt like a lot of time had kept going by. We tried many things. We brought him into the neighbor's house, into the AC, laid him on the cold floor, and it just really wasn't getting better. He was confused. And,
Okay.
I just felt like enough time had went by. I didn't want to gamble anymore.
Okay, so when EMS was telling me that his temperature was 102, his heart rate was 180, and he told me his blood pressure was normal. Was that correct?
Okay. Yeah, I think so.
Okay.
I really don't remember.
And then they said the heart rate went down to 150 as he was cooling, and his mental status kind of improved in the ambulance. So, so Jennifer, where do you think he fits in the whole heat-related illness?
More of a heat exhaustion, which again, it kind of implies a little bit higher of a body temperature. So for him, since his body temperature was 102, that kind of moves us right into more of the definition of a heat exhaustion. So, but
And I forgot to mention,
yes, ma'am.
When we were like initially on the sidewalk thinking, oh, he'll recover, but when I know he lost a lot of color out of his lips.
Okay.
And I remember that was another thing where I'm like, this isn't exactly normal.
Yeah.
And it, again, just kind of heightened my concern a
Yeah.
little bit.
What's the last thing you remember before being here?
Running.
Running. Okay. Do you remember not feeling well? No. Okay. So you started the run, and then the next thing you remember was what?
I woke up in the guy's house.
You woke up at the guy's house. So at the doctor's house? Okay. Do you remember how you felt then?
I felt scared,
Okay.
I guess.
Did anything hurt? No. So your head didn't hurt. Did you feel like you wanted to throw up? Did you feel sleepy?
Kind of.
Kind of. Did you feel hot? Yeah.
So he must have been altered significantly, because if he doesn't remember, did you have trouble getting him into the
yes,
house?
we did, and there was weird behaviors, like he was almost
Combative?
tossing things off of us. Yeah, a little.
Yeah.
That's a good descriptive word. I mean, it wasn't crazy, but
Yeah,
you know,
yeah.
as the mom, I
Yeah.
know like this is not normal. He does wear glasses, so we had taken them off of him just to keep him comfortable, and he kind of just swatting us away
Okay.
as we were trying to still like keep him cool and stuff,
Okay.
and that was different for sure.
Quick question for you, buddy. Did you eat breakfast this morning?
No.
No. Okay. Did you eat anything before you went for a run? No. Did you drink anything before you went for a run? No. So you just woke up and went running? Okay.
Basically, we did. We both did.
All right.
Yeah, not good. Yeah.
Have you?
So basically, didn't eat or drink all night long, so
Right.
he was probably a little volume down to start with.
Right.
So it'd be interesting if we knew really what his blood pressure was actually, but maybe we can find an EMS report to document that. But that's an interesting point that just made him a little bit more vulnerable. He probably should slug down fluids before he starts.
Yeah.
Well, that's a good
we
learning
just
point.
didn't think about it. Yeah.
Yeah. I'm sure I've done the same thing.
I've
Exactly.
certainly done the same thing.
Yeah.
Yeah.
Mom, did you notice any swelling, or did you see any sort of like? Did his fingers look swollen to you, or did you see any of
Now-
his veins like super?
Now I got history though that he had edema or swelling of his fingers.
But I didn't look.
Okay.
Again, we were just trying to get him into a cool. We were trying to get him out of the heat into the cool.
Hey, did your fingers feel swollen though?
In the ambulance.
In the ambulance. Okay, so there's a little heat edema sort of thing, and it's a dependent sort of the fingers and the feet. A little kind of a dependent edema that sometimes develops in the heat.
Absolutely. So certainly the scarier things that we see is when you're not sweating at all. So that's the further steps out is that you've lost the ability to regulate your own body temperature.
And then so talk a little bit about heat stroke, like the where you have end organ damage and actually central nervous system signs and symptoms
Absolutely.
too.
So that's when so heat stroke is the end of the spectrum. So that's if we
And you don't want to go there.
We do not. And so that's where, like I was talking about, you've stopped sweating altogether. If you were to check a core body temperature, you're moving in the 104s, 105s, 106s. Oftentimes, there is severe neurocompromise in the sense that obviously confused or typically unresponsive.
Yeah,
or very
even
altered.
comatose or having seizures. So we're giving him about a liter of fluid there. We're giving him a little bit of a fluid bolus, and then we're checking some basic labs on him, just make sure his electrolytes are fine. I'm sure they're all going to be fine. Jennifer, talk to us a little bit about how you avoid heat injury, besides staying out of the heat.
I don't want this to happen again.
Oh, yes. No, so absolutely. And so being in the heat, certainly in the southeast, is essentially unavoidable unless you're in the building all the time. And, you do, so I will say that as a caveat that we do try to encourage people, if you can, to kind of stay out of direct sunlight for long periods of time.
Or if they're going to be out, start to get acclimatized, be out there for short periods of time.
And slowly kind of work
Get
forward.
acclimatized, yeah.
Mm-hmm. So big things to kind of think about are number one, you always want to make sure you have energy to actually do the activity that you want to do. So really important to at least have a little bit of food, and certainly make sure that you're drinking plenty of water. And the big things are to replace what you lost. So typically water is fine, but if you're doing some sort of strenuous activity, so you are training for a marathon, or you're doing prolonged practices, so for football, especially in the summer when they're doing their trainings, or even people who are in marching band or some sort of formation outside, so military as well, and they're standing outside doing their formations, or heavy weightlifting. All of those things have the potential to cause significant strain on the body. So that's when your body will increase the sweat, which makes you lose a fair amount of salt. So you need to replace that. So water is not going to be enough at that point, and you want to replace with some sort of electrolyte containing fluids, a Powerade, Gatorade.
So we really appreciate you guys being willing to do this, and I think there's a lot of people out there who will watch this who need to hear this information and actually say, oh my goodness, that could be me laying there in that bed.